Welcome everyone. So I'm your host Avleen, and today we have a very crucial and a sensitive topic to discuss: navigating an HIV pregnancy. So we are honored to have Dr. Manju with us, who is having an expert experience of 18 years in obs and gynae. Welcome, Dr. Gupta. So I'll just start with my first question. Uh, so I wanted to know, let's start by acknowledging the emotional challenges that comes with an HIV positive pregnancy. Can you shed some light on what expecting parenting may be feeling?
See, hello everyone. See, what happens is that HIV, definitely yes, till now, it being a long-standing disease and quite old, people have been known it since long, but still it is considered a taboo. And an expecting mother getting to know that she is HIV positive, so there are many emotional turmoil which goes under her. First of all, getting to know that she's HIV positive, if she gets to know during that pregnancy, then obviously there is a question which comes to her mind that how has she acquired it. First of all, there is a denial phase when it is very difficult for her to accept that she is HIV positive, and the same is for the partner and the family to accept. If the mother has always known that she is HIV positive, and then by that time, and then they plan the pregnancy and then they come to us, then handling the pregnancy is much easier. But for the first timers who get to know during the pregnancy, definitely it is quite a challenge to make them understand and to counsel them to continue the pregnancy. So the thing is, which comes to their mind is that they start blaming themselves, or first they are in the denial phase, they do not agree with the report. Then the confirmatory report, when it also says that they are positive. Then we have various support groups, and we tell them that it is not your fault or fault of anyone which has made them acquire this HIV. So this is how we tell them that this is a disease which can happen to anyone. There are few habits and few things which makes us more prone to have this disease, but you are not to be blamed for having this, and you have complete right to be pregnant and give birth, and there are many ladies who have given birth still being HIV positive. So this is how we do it.
Okay. Also, there is a lot of stigma surrounding HIV. So, how can we break down these barriers and encourage open discussions about HIV positive pregnancies?
Yeah, so we tell them various examples. We have various support groups also. Every hospital, government hospital, have a support group in which the counseling is done, repeated counseling is being done, so that patient is able to come out of this trauma of being HIV positive. For various mothers also, pregnant mothers, we have other ladies who have delivered being HIV positive. So we have a connect with them. We ask them to connect with the peer group who is HIV positive, so that they get to know that yes, despite being HIV positive, they have been able to give birth happily to healthy babies, and we tell them that it is nobody's fault. This is how they get to know. And moreover, we tell them that yes, with so many things around, so many advances happening in science, it is possible to live with HIV with not much of morbidity.
And from medical perspective, what precautions and treatments are available for pregnant individuals with HIV?
Various treatments are there. Antiretroviral therapy, for which again there is a proper units are there. They are proper allocated clinics for HIV antiretroviral therapies. They are widely available for the people who are HIV positive. So on the depending upon the viral load and to prevent the transmission to the baby. So these clinics are there through which they are provided the treatment, so that a transmission to the baby is completely avoided. So it is quite possible that an HIV positive mother delivers a healthy baby without transmitting it to the baby.
Okay. And Dr. Gupta, what kind of support systems are available for individuals?
Support systems are in form of counseling groups. The centers for treatment are available, counseling centers are available, peer groups are available, which help them in combating the stress of being positive and the treatment also.
Okay. And lastly, what message of hope and positivity would you like to share with expectant parents who are facing an HIV positive pregnancy?
See, we should not lose hope anytime. This is not your fault that you have had HIV, even if it is a fault. Even if it is, still there is a life ahead, and you can very well give rise to a healthy baby and a healthy human being even with being HIV positive, and there are many such examples in which HIV mothers have given rise to babies who have had no and the transmission has been completely avoided by having elective cesarean sections and many things. So you should not lose hope that you being HIV positive will turn into 100% HIV positive baby. Nothing like that. So this is a very positive thing which we should tell them, and this is how they are able to abate this.
Okay, great. So thank you so much for answering all my questions and sharing your expertise.
Thank you.
And thank you very much to all our viewers for joining us.